we're the Height Scanner Group. My name is Dean. This is Pranim, Giovanna, Sim, and John, respectively. So our current problem is that patients go to hospitals and they're admitted, and they may or may not know their height. This can be for various reasons. Maybe they haven't been to the hospital in a long time and they've grown, so they don't know how much they've grown. Or they suffer from a disease where they can't remember back as far as the last time they went to the hospital what their height was. Furthermore, they could have certain diseases that make it very hard for them to ever have gotten an accurate height, such as cerebral palsy, which are different very much so from someone being paraplegic, where you could actually lay them down and you could measure somebody who is paralyzed. But someone with cerebral palsy, it's very difficult to be able to control their body to have them lay flat for as long as it would take for you to take a standard height measurement. Furthermore, the problem with height, of why it's so important, is it's one of the only two calculations needed to calculate your body mass index, which is used in your drug dosage, how much you get for ventilations, and how much food you get. So this could cause malnourishment or overnourishment for patients. And the current system that nurses are forced to use is called the Demi-Span equation, which would take from the midline of your sternum to the third phalange of your middle finger, and multiply that height by 2. John over there stands at 5'10". From his third phalange to his sternum is 33 inches. So we should guess that he's about 66 inches, which is true, but that's also 4 inches off.
So from our research at Lower General Hospital, we learned that 50 patients today are being admitted to Lower General and are reporting inaccurate height information. Now, Lower General Hospital is a medium-sized hospital with a total of 220 licensed beds. And as of that, there are 6,000 hospitals in the United States and 10 times that number worldwide. So we estimate that the value of such measurements is greatly needed yearly.
Through recent talks with certain professionals in the field, we were able to gather that about each scan could be an approximation between $5 to $10 per scan, which would get us upwards of about $1 billion yearly growth in the entire United States. And currently, we are in an untapped market, as there are no other competitors that do anything that we do besides just this standard practice of you stand against the wall and we measure your height.
So for our solution, we want to use the principles of photogrammetry to take an image of a patient using a lens such as this and an off-the-shelf cell phone component. And the nurse takes an image, and it takes two images actually at different angles, and then you can, using software, put that back together, and through the use of virtual reality, have a 3D model of that patient. And using software and what's called a cursor, we could put a stick figure model over the patient in that image, send it back to a software service that we develop, and return that height information back to the nurses. And we're hoping, looking at an accuracy of 1 to 2 inches versus that 4-inch spread with the Demi-Span equation.
Our current business model is very similar to an approach that a current cell phone company would use. You would buy our device, and then we would sell you a subscription of however many scans you would need. If you go over that many scans, that's fine. There's just a charge after that, such as if you go over your minutes on your phone, if you only have a certain amount, you just get surcharged a little bit. And yeah. The current resources is we're asking for $5,000 in startup to finish up some prototype capturing systems and to finalize out our 3D model visualizations, as they're not exactly where they need to be right now for us to do proper testing. From there, we'll take the remaining amount of that money to begin our testing in clinical settings of first trying to take measurements of people that we know their height very well and try to be able to match that accuracy with our device. And we plan on continuing our partnership with the Lowell General Hospital and certain students who are currently at UMass Lowell, such as Sim and John themselves, and partnering with the Massachusetts Medical Device Development Program.
Thank you so much for listening to us.
Great, thank you.
Thank you.
Well done. Do you guys have any
Yeah,
questions?
nice job. I have a question.
Yes, of course, what's your
How
name?
did you come up with this idea?
We came up with this idea. We have a relationship with the hospital, being the local school. So we went and we toured there. And one of the concerns that a dietary nurse set forth to us is that it can be hard for patients to for nurses to know a patient's actual height. And she specifically cited a lot of times patients will come in and they won't exactly know their height, or it'll be a rough estimate, or it can even force nurses to have to go into a deep dive of the person's medical records. Or even as far as in an emergency department, a patient comes in, they are unconscious and need emergency ventilations, and the oxygen concentrations have to be very precise, otherwise you can actually kill somebody by giving them too much oxygen and they stop breathing. So all these factors led to them really needing to know the exact height, and the guesses that they're putting forth, the accuracy is too far of a tolerance for them. And so there was a dietary nurse at first, but then other departments echoed her sentiments.
Have you determined the accuracy that you need in the modeling that you're doing? Sort of a technical question, so it's probably you guys. You set like requirements and you kind of have an understanding of where you're trying to get to?
Yeah, the goal when we were speaking with the nurses was 1 to 2 inches, and we think by, Sin's actually been studying some of this too, the physics behind it, we think we could achieve that.
Around, well, plus or minus 1 inch is kind of like where it's like, that's kind of the thing that kind of validates our product,
Okay.
that we make it valuable.
How important is the height versus the weight? Because when you're looking at drug dosing, or you're looking at food distribution, it's really based on the body mass of the individual. So how important is height? And is there any literature out there that demonstrates a causality, a connection that demonstrates that the inaccuracy that exists with the multiple methods today are really a problem?
Yes. So the body mass index is what's used for the several things, such as the ventilation, how much food you get, and certain things like that. To calculate body mass index, it's a simple height times weight correlation. So they're directly related. So if the weight is off and the height is correct, then you get an inaccurate BMI. Similarly, if you have a weight that is correct, which is very easy to do, which is gaining very easier to do by modern bed technologies being able to actually have weighing systems in them, we are able to calculate very precisely a weight. But the height is now what's becoming more and more inaccurate as the weight does become more and more accurate, which makes the BMI scale less and less accurate. Going into the future, another part of this that we want to develop is we actually do want to look into the ability to take this same scan, the same picture, and using several technologies, be able to actually calculate the volume of the person, and then you can deduce a mass from that, which we can get the weight.
Is this going to be considered a medical device? Have you researched that?
We are trying to get this considered as a medical device, yes. At first, it would have to be used as a measurement device until we can get it adopted by a certain hospital. So we're trying to get it to be as a medical device. We'd obviously have to go through the FDA approval and such. And our current goal with that would be go through them and try to get it into a hospital, and really trying to target a hospital that has good relations, like a Circle Group hospital such as Lowell General, so that if it's implemented there, it tries to get implemented throughout the other hospitals as well to heighten our exposure.
I like that heighten our exposure.
Sorry.
I was not,
I love
yes.
Yep.
Just a happy accident.
An IP examination that you've done so far?
Can we get on to
Intellectual property, patents? What have you looked at out there so far?
So far, a lot of the patents that come from this field are not related to what we want to do, what we want to use it for. There has not been, from what the extent of our research has found, of using photogrammetry to determine height for medical use before. So we are currently still in the process of making sure that photogrammetry has not been patented anyway, but it's a pretty generic technology, but we would get a patent for its utility use in this field.
And so how far have you gotten at this point with actually having a measure? So you've got the little device that you're recommending that you're going to be using, and so how far are you? You talked about validating your work and...
Well, so in terms of a working prototype right now, we don't actually have one that can calculate a height to any degree. What we do have are several products, such as this lens, and we also have some VR technology that we're just using to just kind of prove that we can take 2 pictures and we can like extrapolate a 3D single image. We're still working on, so the core IP aspect of our product would be the algorithm to take that 3D picture and be able to like put a skeleton onto that image. That's kind of like what we've been focusing on right now. So once we do have that algorithm finalized, we can go forward with like creating technology around that algorithm and just like implementing it.
And where will the algorithm reside? Will it be on the phone, or would you gonna send it remotely off?
It will be sent remotely back to our servers and be done offsite.
Have you done any research on how long it's gonna take to go off, be analyzed, and come back to the nurse? Because I would think she'd be looking for like a real-time type of number.
That's something that we wanted to address. Time really isn't an issue here. So for the most part, most of the issues that will be brought up with medical devices are this will be faster, this will be better because it is faster. Our device is better because it is accurate. Accuracy is the main problem. So if a nurse has to wait, say, 10-15 minutes for a measurement to come back on the height to calculate the body mass index from that, and therefore to be able to determine how much nutrition it gets, it's not going to be as detrimental to the patient as it would be to give an incorrect dosage. So our main strength comes from the accuracy rather than the time.
Yeah.
I can tell you from experience, more medical devices fail because of use errors and use problems than they do because of accuracy and technology. Unfortunately, the nurse may say 10 minutes is too long or 15 minutes. You guys probably know better than I, but so I would make sure you consider that when you're setting your requirements and say, okay, maybe I need to have it done in 5 minutes or 4 minutes, but do some research on that. I mean, accuracy is important, but if people aren't going to use it because it's 10, 15 minute lag before they get the data, then it's of no value to anybody. So just consider that as you're doing research.
Okay, thank you.
Any other questions?
That's
Thank you
good.
guys
Good job.
very much.
Thank you.
Good
Thank you.
job.
Thank you.